Good afternoon. I'd like to welcome you to today's webinar entitled Coronavirus, What Nurses Need to Know to Be Prepared, presented by Goodwin Veenema. My name is Brian Carey, VP of Marketing here at Unbound Medicine. In this webinar, Tenor will discuss how the nurse's role has changed in the event of an infectious disease outbreak like coronavirus, the most effective infection containment strategies, ensuring nursing students are prepared as they enter the workforce, and the latest disaster nursing technologies and resources that are available. This webinar will be about 20 to 25 minutes with some time for questions at the end. Please submit any questions you might have in the designated area at the side of your screen. If we don't get to your questions during the live presentation, Tenor will answer and reply via email to the whole group. This webinar is being recorded, and we will send a link to everyone within the week so you can share with colleagues or watch again at any time. Okay, let me briefly introduce our presenter. Goodwin Veenema is a professor of nursing and public health at the Johns Hopkins School of Nursing and the Johns Hopkins Bloomberg School of Public Health. Tenor is an internationally recognized expert in disaster nursing and public health emergency preparedness and is the CEO of the Tenor Consulting Group. Dr. Veenema has served as a senior scientist to numerous federal agencies and is a member of the National Academy of Medicine Forum on Medical and Public Health Preparedness. Dr. Veenema is the editor of Disaster Nursing and Emergency Preparedness for Chemical, Biological, and Radiological Terrorism and Other Hazards, which is now in its 4th edition, as well as the Disaster Nursing app, which is published by Unbound Medicine. At this time, I'd like to welcome Tenor to take over the presentation. Thank you very much.
Thank you so much, Brian, and good afternoon, everybody. It really is an honor for me to be here today and have this opportunity to speak to all of our nation's nurses on a topic and an outbreak that certainly has captured all of our attention, a lot of media coverage, a lot of information being dispersed across the internet and social media. And I think it's really important for us to take a moment and look at what the science tells us about this current coronavirus outbreak and really drill down to what nurses and nursing students need to know to be prepared and to keep themselves safe. So to recap what we're talking about today, the coronavirus was an outbreak of a respiratory disease, a new or novel coronavirus, meaning a strand of the disease that we have not seen before in the human population, that was first detected in 2019 in Wuhan City in Hubei province, China. Now it has actually spread and been detected across, and again, some of these numbers I will be updating as of what has happened this morning. It has spread and been detected in 37 locations internationally, including some cases here in the US. The virus itself has been named SARS-CoV-2, and the disease that it causes has been named coronavirus 2019, or we're calling it COVID-19. On January of this year, the World Health Organization declared the outbreak a public health emergency of international concern, and a day later, Health and Human Services Secretary Alex Azar declared it a public health emergency in the United States. And so these things have urged us as the nation's healthcare community to respond and to be prepared for the spread of this illness here in the United States. The SARS-CoV virus is a beta coronavirus, an RNA strand virus that bears striking similarities to MERS and also to SARS. So historically, we have seen similar viruses before. All 3 of these viruses have their origins in bats, and the sequences that we have derived from patients here in the US are similar to the one in China that was initially posted, which suggests to us a likely single recent emergence of this virus from an animal reservoir. Interestingly enough, from an update that I heard last week from the CDC, A lot of belief had been that this virus originated in a wild animal seafood market in China, but they have yet to have identified an animal that did test positive for the virus. So in actuality, we know that the virus did travel through that market, but it did not originate from that market. It came from somewhere else, and they're still working to identify that source. Person-to-person spread has been reported outside China. And of course, we are seeing now sustained person-to-person spread within China. In addition to that, other destinations have apparent community spread, meaning that some people have been infected with COVID-19, and we are not entirely clear how that transmission took place. So we have seen people who have traveled to China or from China who definitely have contracted the virus there. We have seen close contacts of those individuals catch it in that person-to-person transmission, but now we are also seeing it spread to others where there was no known source. This is a map that I pulled off of the World Health Organization a couple of days ago. It has since spread to additional countries and continents since this was published just over the weekend. One place that I'm going to direct you to go so that you can really see real-time data on the evolution of the COVID-19 outbreak is to an interactive GIS data map that was developed and published by the Johns Hopkins Center for Health Security in collaboration with the School of Engineering here at Hopkins. And what you have in front of you on this screen is a screenshot that I took at 8 o'clock this morning. This is really an extraordinarily valuable resource. I urge you to search Hopkins coronavirus COVID-19 map, and it will give you an up-to-date report of where the virus has been detected, where cases have been confirmed, what the total reported deaths are, and how many individuals have recovered. It also allows you to sort of highlight over some of these red circles and get more detailed information, which is really helpful for us in the healthcare system to be able to plan, prepare for, and respond to the spread of this outbreak. So I'm going to pause for a second and talk about some of the clinical features and risk of infection, but I also want to take a moment because there's been a lot of concern over the use of the word pandemic and whether COVID-19 will truly become a global pandemic. And I urge you to remember that pandemic comes from the word pan, broad, or a broad spread of an infectious disease. So a couple of things that are really important to note with COVID-19 is the fact that this disease has caused illness, including illness resulting in death, and sustained person-to-person spread is very concerning. And these factors meet two of the criteria for a pandemic. As community spread is detected in more and more countries, the world does move closer towards meeting the third criteria, worldwide spread of the new virus. The potential for public health threat posed by COVID-19 is high, both globally and here in the US. That said, the current risk in the US is low, and I urge you to remember that the word pandemic describes the spread of an infectious disease. It does not necessarily describe its lethality. Community spread here in the US could be reasonably mild, or it could be very severe. And so one of our challenges with COVID-19 is that we still don't have a clear picture and understanding of all of the clinical features and the risk of infection from this disease. So just to highlight some of the things we do know is that the clinical spectrum of COVID-19 ranges from a very mild disease with very nonspecific signs and symptoms of a typical acute respiratory illness to the other end of the spectrum where we see severe pneumonia with respiratory failure and septic shock. We also have seen reports of asymptomatic infection with COVID-19. As far as we know, with the limited data that has come out of China, currently those individuals at greatest risk of infection are persons who have had prolonged unprotected contact with a patient who is symptomatic with confirmed COVID-19, and as I've mentioned earlier, those with recent travel to and from China. The available data are really currently insufficient for us to identify the specific risk factors for those with severe clinical outcomes. We do know that individuals who are older adults and those who have underlying chronic medical conditions or immunosuppression may be at risk for more severe outcomes. And to date, that is the clinical picture that we have seen. The onset and duration of viral shedding and the actual period of infectiousness for COVID-19 is still not known. It is possible that the SARS-CoV RNA virus may be detectable in the respiratory tract for weeks after illness onset. However, we need to remember that the detection of viral RNA virus does not necessarily mean that the infectious virus is present. As I mentioned earlier, asymptomatic infection with this virus has been reported, and we're still thinking that the incubation period may range from 2 to 14 days. And thus, that is the reason you are seeing that when individuals are quarantined, it's for a period of 14 days until we have a clearer understanding of the incubation period of this virus. So just reminding you that close contact can occur when caring for a patient, including being within approximately 6 feet of a patient with confirmed COVID-19 for a prolonged period of time, or having direct contact with infectious secretions from a patient with confirmed COVID-19. We still have limited data about the detection and infectious virus in clinical specimens. What we do know is that this virus has been detected from upper and lower respiratory tract specimens, sputum, bronchoalveolar lavage fluid, and in blood and stool specimens. An interesting report that came out of China yesterday, according to the South China Morning Post, China instituted a 14-day quarantine for those who have recovered from COVID-19 because several discharged patients tested positive for the virus. The medical professionals have warned public health officials of this phenomenon and have warned about the increased logistical challenges they are experiencing of handling these individuals in an already resource-constrained environment. So there may be a lesson in here. China CDC has said that the definition of close contacts who should undergo monitoring should be expanded, as it is possible that some individuals could transmit the virus 2 days before becoming asymptomatic. So what's the current picture here in the United States? We have confirmed cases totaling 57 individuals, although of those, 36 of those cases are confirmed from individuals who were quarantined and then repatriated to the United States from the cruise ship, the Diamond Princess. The image that you're looking at is a CAT scan of the lungs of some of the Chinese patients, and this was published in an article in Lancet, of those who went on to develop more severe respiratory disease. And interestingly enough, it was in the second week that these patients were sick that they developed more severe complications from the infection. So if you look at the periphery of the CT scan, you'll see sort of what is called a shattered glass image. It's not clear yet. We don't have high enough numbers to know if this sort of radiographic finding is pathognomonic for the COVID-19 infection, but I think it's interesting to know. And again, this was published in the literature. So what may happen in the US? Some of you may have listened to the public information session that was hosted by Health and Human Services yesterday and the CDC on what they're thinking may happen here in the United States, and to Dr. Nancy Messonnier, who's director of the CDC National Center for Immunization and Respiratory Distress, in her statements to us to really consider that it is not a matter of if we will see coronavirus and COVID-19 in the US, but a matter of when. So more cases are likely to be identified in the coming days. It's also likely that person-to-person spread will continue and will be sustained. Widespread transmission of COVID-19 in the US would translate into large numbers of people needing medical care at the same time. So our hospitals and our health systems and clinics, community clinics and doctors' offices would experience a surge in that demand for healthcare services. We may also need non-pharmaceutical countermeasures to be employed to try to stop the spread of illness and contain the disease. And so things like school closures, daycare closures, workplace closures, mall closures may be instituted should the spread of the disease reach a point where the CDC felt it was necessary to implement those measures. Even prior to those measures being implemented, you may see schools and childcare centers and the workplace experiencing more absenteeism. As I've mentioned earlier, public health and healthcare systems will undoubtedly become overloaded. And we need to keep in mind that our emergency departments are really functioning on the verge of overload on a daily basis in the US right now. So the amount of flexibility within our healthcare system to surge up at this time is truly constrained and something that we need to actively plan for. Other critical infrastructure, such as law enforcement, EMS, and the transportation industry, may also be affected. So, what do nurses and other healthcare personnel need to know about caring for patients with confirmed or possible COVID-19 infection? And how do we keep ourselves and our colleagues safe? So, we know that healthcare personnel and nurses specifically, we are on the front lines of caring for these patients and for caring for any patients with suspected respiratory illness. Because of that, we have an increased risk for exposure to this virus. And yet we know that there are a number of strategies that we can implement both at home, out in the community, and in the workplace to limit our risk of contracting COVID-19. So let's talk about what some of those are. And the first thing and the most important thing that I want to stress to you is to constantly go to the CDC website for guidance on infection control and prevention and for daily updates on how this outbreak is evolving. The Centers for Disease Control and Prevention in Atlanta is our gold standard for scientific, evidence-based, reliable, current information on how we should be dealing with this infection, what infection guidelines are, and what we as nurses need to know in order to keep ourselves and our patients and our families safe. So please, if there's one take home from my presentation today, become very familiar with the CDC COVID website and check it on a daily basis. So let's talk about some of these strategies for caring for patients and for keeping ourselves safe. So healthcare personnel caring for patients with confirmed or possible COVID-19, again, should adhere specifically to those CDC recommendations for infection prevention and control. And at baseline, that means assessing and triaging patients with acute respiratory symptoms and risk factors for COVID-19 to minimize chances of exposure, which includes immediately placing a face mask on the patient and isolating them in an airborne infection isolation room if available. From there, we want to use standard precautions, contact precautions, and airborne precautions, and eye protection when caring for patients with confirmed or possible COVID-19. And I've screenshotted from the CDC just to remind us what standard precautions for all patient care are. Performing hand hygiene on a regular basis, using the appropriate level of personal protective equipment whenever there is an expectation of a possible exposure to infectious material. And that would, of course, include all of those respiratory secretions, sputum, blood, and feces that I've mentioned earlier that we know we have cultured the SARS-CoV virus out of. Following respiratory hygiene and cough etiquette principles, ensuring appropriate patient placement and distancing from individuals that have respiratory symptoms, the proper handling and proper cleaning and disinfecting of patient care equipment, instruments, devices, and of course the environment itself. We do know that COVID-19 is spread through respiratory droplets, but it has also been cultured off of contact surfaces, and yet it can easily be cleaned and removed with a number of approved cleansers. Handle textiles and laundry carefully, follow safe injection practices, and wear a surgical mask whenever performing any invasive procedures. And ensure healthcare worker safety, including proper handling of needles and other sharps. So these are our basic standard precautions for all patient care, but it's really important that we keep these in mind now in the environment of such an outbreak. Things that you can do to protect yourself and also share with your colleagues, your family, and your friends, they sound simplistic, but they've never been more important. Hand hygiene, hand washing is single-handedly the most important public health measure to control the spread of disease globally. So for all of us to perform regular hand hygiene with an alcohol-based hand rub before and after all patient contact with any potentially infectious material, and before putting on and upon removal of personal protective equipment, including gloves. You should use soap and water if your hands are visibly soiled. And when we're not in the workplace, we need to be encouraging everyone to be washing their hands very frequently. Practice in the workplace how to properly don, use, and doff personal protective equipment in a manner to prevent self-contamination. We've learned an awful lot about nursing and the use of PPE since the SARS outbreak in 2003 and through the two Ebola outbreaks that we've experienced recently. It is really important if nurses are to protect themselves to know how to don and doff PPE appropriately and safely. Perform aerosol generating procedures, and that would include the collection of any diagnostic respiratory specimens in that airborne isolation room while following appropriate infection control practices, and again, wearing the appropriate level of personal protective equipment. I've touched earlier on this concept of environmental cleaning and disinfection, which is going to be so important if we do start to see more of this virus in US healthcare settings. Management of laundry, food service utensils, and medical waste also will need to be performed in accordance with any CDC guidelines for infection control for COVID-19. Should you, for any reason going forward, feel that you have been exposed to, had an unprotected exposure, for example, you're not wearing the recommended PPE to a confirmed or a possible COVID-19 patient or to infectious materials from a confirmed or possible patient, you would want to contact your supervisor and occupational health within your organization immediately. If you develop symptoms consistent with COVID-19, so fever, cough, sore throat, difficulty breathing, do not report to work. And again, contact your supervisor or your school or your occupational health services to let individuals know about this. So again, I want to take one moment just to go over those basic protective efforts, using appropriate respiratory and cough etiquette, using alcohol-based hand sanitizers and washing your hands frequently. Avoid touching your nose or mouth, and then maintain distance in avoiding others as best you can who are ill or in the workplace, ensuring that you have personal protective equipment on when you assess, triage, and care for these patients. Should this outbreak expand within the US, I think it's very reasonable to ask nurses to self-monitor for respiratory symptoms and even to potentially take your own temperature twice a day. We really want to keep ourselves healthy. We want to keep our nursing colleagues healthy, and we want to maintain infection control and containment strategies in a very systematic and consistent way. I also want to take a moment to remind everyone that seasonal influenza is still very high at this last week in February, and that, it's really interesting. We have approximately 46% of the US who got a flu shot last year, which means that 54% potentially have not gotten that vaccine. So we have a lot of work to do as nurses. While we want to educate our patients and our colleagues and our community members about the reality, the risk of coronavirus, I think it's really important to stress to people that seasonal influenza continues to be a significant public health risk here in the US. We have already seen over 29 million people in the US infected with seasonal influenza, well over 200,000 hospitalizations, and 105 pediatric deaths this year from seasonal flu. So let's keep in mind that infection control strategies, disease containment strategies are very important across all broad spectrums of respiratory illness. Again, you can go to the CDC, you can go to WHO's FluNet and get an up-to-date, almost daily or weekly picture of where we stand in the United States in terms of outbreaks and persistence of seasonal influenza. I want to take a moment to thank Unbound Medicine, who's been a wonderful partner with me for many years. I have had the great honor and pleasure of working with some of the finest nurses and nurse educators across this country to develop resources designed to make every nurse a prepared nurse and to give nurses and nurse educators, nurse executives, and nursing students the tools that they need to understand this broad spectrum of diseases and public health emergency events similar to what we're dealing with right now, to have that point of care, evidence-based, current, valid, and reliable data that we can use to drive our practice and to drive our health systems and also to keep ourselves safe. So I will be touching base on both the disaster nursing app that Unbound Medicine has published. Again, this was derived from the science. It was designed specifically for what nurses need to know. There are a lot of apps out there that address disasters and different types of emergencies and infectious disease outbreaks, but this one really drills down to the basics and then the clinical care and what nurses need to know to practice effectively. Our app covers over 404 different types of disaster events and infectious disease pathogens. We are currently this week updating the coronavirus information, so it will be there. We've also added the International Council of Nursing disaster nursing competencies, so a real resource for educators as well who really want to be able to give their students as much information as possible on these types of challenging public health emergency events, given how constrained current nursing curricula are and how busy we all are in the workplace. Again, I have to give a shout out to a lot of the colleagues that I work with across the country. I have been just so privileged to work with a team of nurses who've contributed to a number of different resources, all of us because we are very committed to nurse safety as well as patient safety and creating environments where we all can go to work, feel confident that our organization will do its best to create clinical environments where we can be safe and we can care for our patients the way we want to and provide that consistently high quality, scientifically driven care. So in summary, I want to say that, again, this outbreak is evolving rapidly, and we really need to keep an eye on it. We need to pay attention to the significant public health risk that it is creating and recognize that it may become pandemic. The potential public health threat is high, both globally and in the US, but at the moment, the risk within the US is low. And remember, we still don't have a clear picture on the ultimate mortality or lethality about this. A lot of the individuals who have contracted COVID-19 are recovering. And so we're looking forward to really being able to characterize a clearer epidemiological picture of this illness. We do know that nurses are the front line of the healthcare system, and we will be at risk due to our close proximity to patients. And for those reasons, again, I urge consistent application of infection control measures and that they are sustained and maintained as best we can with the information as it evolves about this outbreak. I urge you to use all protective measures from the simplistic regular hand washing and respiratory and cough etiquette to the appropriate selection and correct use of personal protective monitoring, personal protective equipment, and of course, self-monitoring of any signs of fever or respiratory illness. On that note, I want to thank you all sincerely for your interest, for your participation and attendance in this webinar, and your commitment to really fostering what we do best as nurses, which is infection control and protecting and promoting the health of the public. Thank you.
Great, thank you, Tenor, and thanks for the information on this very important topic. Do you have a moment for a question or two?
Absolutely.
Great. We have quite a few nurse educators on the line, and there's several questions all around the same topic, and that is, nurse educators don't have a lot of time to devote to disaster nursing. So what's the most important thing for nursing students to know about this outbreak, and what can they do to help keep themselves safe?
Well, that's an excellent question, Brian. Thank you. So let me answer it, first of all, in particular to the COVID-19 outbreak. I think that given these very accelerated and time-constrained academic nursing programs that we're experiencing in the US right now, the most important thing that nurse educators can share with their nursing students is the basic fundamentals of infection control and those disease containment strategies that we need to be aware of what they are and how they work. So the fundamentals of surveillance, detection, isolation, quarantine of those who've been exposed but may not yet be symptomatic, and then knowing where to go to get the most current information in terms of treatment guidance, clinical care guidance, and protective measures as the outbreak evolves. So being able to incorporate going to the CDC website, teaching nurses how to drill down really quickly to what they need to know. The resources that we've developed together at Unbound Medicine, again, an app for the iPhone or Android, where at the point of care or out in the community, a nurse can pull up those current description of the clinical picture of this infectious disease outbreak and what the treatment guidelines are and what the current guidelines are for isolation and quarantine. So I think nurse educators can convey that information to students, and it's really important as we have new graduates entering the workforce that we give them an armamentum of skills to keep themselves safe.
Fantastic. And then the last question, it's come through 5 or 6 times in different ways, and we may need to get back to you on this, but it's the question of a surgical mask versus the N95 mask, on whether one is necessary. What is the need when as far as masks goes with the COVID virus?
So there really isn't just a one-size-fits-all question to that. Our standard personal protective equipment for any patient presenting with respiratory illness has been to immediately put a surgical mask on them. And for ourselves, I would because this outbreak is evolving so quickly, I would suggest that each nurse follows the infection control guidelines of their organization. The N95 masks, by definition, filter out 95% of respiratory particles, and of course are going to give you a significantly higher degree of protection. That being said, we have real serious concerns with vendor supply for all types of masks. And I think it's very valuable for nurses to talk to their nurse managers, talk to their infection control people at their organization to understand where and how much personal protective equipment will be available to them, how they access it, and then as the level of PPE needs go up because of should there be an increase in confirmed cases, what the specific guidance will be.
That's fantastic. Okay, there were some other questions, but we'll make sure we get them answered and emailed out to the entire group. There was also some questions about the presentation itself, which will be, this presentation was recorded, and a copy of it will be sent to all registrants as well as attendees. So at this time, I just want to thank Tenor for the presentation. Tenor, if you can go to the next slide. If anyone has any questions about Unbound Medicine, disaster nursing, the app that can be easily added to, we have a lot of Nursing Central customers that have been listening, so it can be easily added to Nursing Central, or for Nursing Central itself, please contact us at sales@unboundmedicine.com. I will also be following up with a survey about the presentation itself. So if you do have a moment to fill that out, that would be much appreciated. Thank you again. Keep an eye out on your email for future webinars from Unbound Medicine, and I hope you all have a wonderful day. Thanks again, Tenor.
Thank you.